Sonoanatomy of plantaris muscle and tendon. The plantaris plays a minor role in plantar flexion of the ankle. It is also prone to injury, particularly in activities involving rapid running or jumping. So it is actually a small muscle in the posterior part of the knee. It originates from the lateral supracondylar ridge of the femur and it inserts into the Achilles tendon and then attaches to the calcaneum with the tendon. During sonographic examination, few points should be kept in mind. One, it starts laterally and gradually goes distally in the medial side, and then it is the tendon of popliteus is found between medial gastrocnemius muscle and the soleus muscle. Then it is when we consider the knee joint area, then it is superficial to the popliteal artery. It has a close relation with the tibial nerve. Let us see the demonstration of the plantaris muscle. Now, as I put the ultrasound probe in a short axis manner over the at least 2 to 3 centimeter above the knee crease. So, skin crease. So, what we can see here, I can see the biceps femoris muscle and also the two nerves. One is common peroneal nerve and one is the tibial nerve. Now, as I go down, so at present the condyles have not appeared. So as I go down, in one side condyles had appeared. As soon as the condyle appears, I also see the lateral gastrocnemius muscle here. So both lateral and medial gastrocnemius muscle I can see. I am going a bit more distally. So as I go more distally, I can see another muscle is appearing here. So here I can see this muscle is nothing but the plantaris muscle. So here as I go more distally, I can see that plantaris muscle has become smaller, and then this small muscle is now at this point it has become a tendon. This at this point I also can see that soleus muscle has appeared and this is the plantaris muscle which has become a tendon. Now from this point, if I make it as a long axis view, then I will be able to see that how this plantaris muscle becomes a tendon. So here, so this is the plantaris muscle, and as we know that ultimately the tendon goes below the medial gastrocnemius. So this muscle starts laterally, and ultimately it goes below the medial gastrocnemius. So we can see the plantaris tendon. So this is going gradually. The tendon is going gradually below the medial gastrocnemius muscle, and actually this tendon becomes it lies in between the two aponeurosis. One is soleus aponeurosis and one is gastrocnemius aponeurosis. So at this point when there is tendon, we can see three lines. But if I go a bit more medially, I will be able to see only two lines and not three lines. As I am coming on the tendon, it is becoming three lines again. Again, I come laterally, it again becomes two lines only. So wherever these three lines are there, this is the area where the tendon of plantaris is going down, and gradually this plantaris tendon it is going to merge with the Achilles tendon. So in a short axis view, I will start from the Achilles tendon short axis view. So this is the Achilles tendon short axis view. As I am going gradually proximally, I can see that soleus muscle has started. So gradually I am going more proximally. I have to see that a point when soleus above soleus gastrocnemius muscle also starts. So this is the point where gastrocnemius muscle also starting. I can see both the aponeurosis between gastrocnemius and soleus. So between these two aponeuroses, I have to search for the popliteus tendon. So here in the middle portion, I can see that there are, it is the in one portion, this is the area where I can see this is the three lines area. Okay, if I go more medially, then also it is two lines, and if I go distally, then also it is two lines. So gradually I am going above and a point comes when again this muscle, popliteal popliteus muscle starts. So this is the area when popliteus starts. So we can see the starting point where the popliteus muscle starts. So this is the area of popliteus muscle. If I go down, again it will become the tendon, tendinous portion, and I can see the soleus also.